A lot of the people that I take care of now were having to travel a lot of miles to get their care, or they were seeing a lot of different providers before I got down here.
Rural medical services are greatly needed, and doctors like Dr. Art are really needed.
When you see him, he's just as pleased and looking as you've ever seen.
They had a rotating physician schedule where a different physician would see them every time that they needed to be seen. And these were some of the sickest people where it would be better to have an established physician, someone who would see them day in and day out, get to know them, be comfortable enough to put their hand on their shoulder and to ask about their kids, ask about how their jobs are going. Someone who was involved with the community enough that knew exactly what was going on in the community and could ask the right questions and actually know how it affects them.
I'm telling he's the best doctor that we've ever been to.
I feel like we have someone here that knows what they're doing, and it means a lot. Someone that you can entrust your life, your health to, and feel like you're going to get the best services.
Actually, I don't know where I would have went if I couldn't have came here.
She's real good, you know, and I'm glad that she's at this office. This location is easier access. It's right on the bus line when you don't have a ride.
With children, you're talking immunizations, and it's something as simple as telling a mom what to expect. Now, when this person gets a cold, this is the way it's supposed to go. If any of this stuff is happening at the first sign, you need to get in here with it.
If she wasn't here, we'd have to go to the hospital.
I love her. She feels like a part of, the family and stuff. She's one of the best doctors that I've found.
She is more than a physician. She not only deals with the sickness of the baby, she just the family,
It really is a privilege for me to be able to work in a clinic setting like this. And I am able to develop relationships over time with patients that I don't think I could develop in a traditional family practice setting.
You want people in this program that are caring people, that really and truly care about you.
The emphasis is on providing whole patient care.
And I feel like I can confide in anything that's going on in my life. And a lot of the things that goes on in my life has an effect on my health.
So if I didn't have an opportunity to vent the frustration, as I do with Todd, I don't know, suicide was becoming more of an option for me. Who do you turn to? Where do you go?
I'm good at what I do, and I'm good at being able to relate to patients and their families. And if I didn't have the support of an organization like the Community Practitioner Program, I don't know that I could afford to provide that kind of care.
The people here in Newton Grove deserve a doctor that's going to stick with them for the long term. And then it's going to also help them find their next doctor, maybe hopefully 40 or 50 years from now.
I mean, honestly, if it wasn't for the Society Foundation, I don't think I would have been able to stay here.
It's really changed the way I've been able to stay here and not have nearly as much worries about the financial part of it, and can focus in on being a doctor and a husband and a father.
Well, as I can speak for one person who is dealing with a life-threatening condition, that the Community Practitioner Program is a cut above a lot of what I've experienced in seeking out health care, medical as well as mental. And I can say without a shadow of a doubt, I might not even be here today if I were not able to receive the kind of care and services provided through the physician at the Wellness Center, Dr. Wallenius, as a result of your program.